Hey guys, this is Ignacio with North Star Senior Advisors. Welcome to another North Star Presents. Today I have the great pleasure of joining me, Alan Bentley with Towers Home Health. We're here together. It was probably the best way for us to do this, I think.
Sure.
It's a good little spin compared to how we've done it before. So very glad to have you here today, Alan. Appreciate you taking the time. You mind telling us a little bit about yourself and Towers?
No, my name is Alan Bentley. I'm the clinical nurse liaison with Towers Home Care. I've been there nearly 20 years. And we are a Medicare certified home health agency and outpatient therapy company. Our service area is Orange, Seminole, and Osceola County, and we're not for profit. So
excellent. So Alan, we've known each other for a while, right?
Long time.
Let's see. I got into, so for those that don't know, I was in home health previously.
He was the home health guru. Yeah, the guru of home health.
Let's see. I think it was 2006 when I first got in, and I had the pleasure of meeting you back then. And one of the things that I do respect here, honestly, folks, about Alan is his passion. If you know Alan and you watch him, you know his passion for what he does. For the seniors, that's his number one focus. So I've highly respected that of Alan, obviously, through the years, and they do a great job at Towers. We work very closely with the senior living community, assisted living, memory care options. As you guys know, we do senior placement, and we hear nothing but great things about Towers Home Health and what they do in the senior living space. So.
Thank you. And I have a North Star testimonial. I had the pleasure of being in a skilled nursing facility prior to this whole pandemic. And I was doing a chart review, and I overheard a conversation a social worker and charge nurse were having. And they were having difficult placement as far as a patient being discharged from the facility. And I overheard the social worker, who I respect tremendously, say, if Veronica with North Star can't make it happen, it's impossible. So I just want you to know that as a testimonial that, that was huge for me. So right then I was like, they're the bomb. They're the bomb.
Thank you. So today, folks, what we want to talk about was specifically, since we have Alan here, is home health, Medicare home health, of course, and how COVID-19 has kind of maybe shifted things a little bit in the space. So I guess first question for you, Alan, is as a nurse liaison with Towers Home Health, how has things changed for you in your role with COVID-19 and everything going on?
Well, my role has changed dramatically. I'm very hands-on. So previously, the social worker or discharge planner would either call me or text me with a referral. I would go to the facility. I would do the complete chart review. I would coordinate the durable medical equipment for the social worker case manager. And I was able to meet with the patient and the family and give them added reassurance and that they're going to have a smooth discharge process home. Well, with COVID-19, all of that has changed. And now basically the protocol is they either call or text me. I drive to the facility. I text them when I'm in the parking lot, and they then come out, bring the referral, and we have a mini case conference, and then I hand carry it back to my office. From a social aspect, things have changed dramatically. And for those of us in home care who are very hands-on, it can be quite frustrating sometimes.
Yeah, I can understand that. Now, what has Towers Home Health specifically done, would you say, to really ensure the safety of the patients, right? Because we know that, one of the things that have come up with all this is, obviously the utilization of PPE.
True.
And, as home health goes from patient to patient, what steps have Towers taken to ensure that?
Well, we follow the CDC recommendations to the letter, and we provide all of our clinicians with PPE, which consists of the facial shield, surgical mask, gowns, gloves, hand sanitizers, disinfectant wipes. The clinicians' temperatures are monitored. They're asked to stay home if they're not feeling well. And they are tested, and we carefully screen each patient admitted to service.
Excellent.
Yeah.
Excellent. Good. So let's say, for example, you do get a referral, and they happen to have active COVID-19, right?
True.
So how does your agency handle a patient that currently has COVID-19? How do you provide care for that individual?
Well, initially we are upfront and notify the clinician immediately. The clinician at that point, when they visit the patient, must wear all PPE attire, including the N95 mask. The patient's condition is monitored. We're in close communication with the physician and the family, and the clinicians are very limited on who will see that particular patient. There's always continuity, and we only allow the essential disciplines in, and we minimize those individuals.
Excellent.
Yeah,
excellent. So
true.
That's a good practice to have. So what other protocols have your agency adapted in relation to the pandemic, would you say?
I think the most exciting for us is telehealth. It's always kind of been on the back burner, but now it's at the forefront. And what typically our protocol is, the nurse goes to the patient's home, the nurse completes a thorough head-to-toe assessment, and then they alert the physician's assistant, nurse practitioner that they're in the waiting room. And then that practitioner comes on the screen and does a home visit. It's literally a face-to-face encounter right there in the comfort of the patient's home.
Yeah, that's excellent. And I know telehealth's been around for a little while.
Yes.
And, more than ever, it's being utilized, which I think is a great resource. It's always been a great resource, but now it makes perfect sense in that. We're seeing a lot of investments going on. I think you may know more than this now is, to what degree is Medicare willing to reimburse telehealth? I know that's always been a question in the past. I don't know if that's...
Yeah, Medicare is fully accepting it now. They're not only accepting it for reimbursement purposes, but as the face-to-face encounter, which is huge. Because prior to that, it was kind of like up in the air. It was kind of like a gray area. But and not only that, you have to figure that a lot of our patients are senior population. They're homebound. So it's a taxing effort for them to get to the physician's office. And a lot of times, a lot of the patients, when they're in the physician's office, their blood pressure is through the roof. And when they're in the comfort of their own home, they're relaxed. And the interaction is just, I find, very comfortable for the patient and the practitioner.
Right. I would agree. Good. So, one of the things that I know you're very involved with is the community as a whole. How have you been able to kind of embrace the community, provide emotional support to your referral sources through all this, which we know has been very taxing for the industry?
It really has been. I think the number one thing is being accessible to our referral sources via phone, text, and emails. Just letting them know that we're here, we're available, anything that they need will rise to the occasion. Also, we do minor things like we'll do like little appreciation breakfast and snacks and lunches and that kind of thing, just to show that, our love and support for them. I know a lot of agencies out there are participating in the motorcades where they kind of drive by and decorate their car and kind of just show their love and support to the healthcare workers who really are on the front line. And it's not just, for me, I'm a nurse, but it's not just the nurses, the nursing assistant, it's the housekeeping staff, it's the dietary staff. It really takes a village. It really does.
Yeah, I agree with that for sure. Well, that's excellent. Good.
Thank you.
What else has changed operationally for your agency, would you say? What other operational updates have you guys done as you practice?
Yeah, and this is extremely important just from a safety perspective for our staff. We allow no more than 10 people in the office at any given time. No one works in close proximity with one another. If people do share a smaller space, one will work remotely. We abide by the 6-foot rule, and employees are always wearing their face mask for protection.
Excellent. Good. So, folks, as you may know or may not know, Medicare covers home health services 100% if you're appropriate. Any changes, Alan, to the Medicare guidelines now with COVID-19 that folks can kind of benefit from?
I think the two major changes that are truly significant are the first one, that the home health plan of care, or what we consider the 485, previously only physicians were allowed to sign that. It was exclusively limited to physicians. Now with COVID-19, Medicare is allowing PAs and nurse practitioners to sign. So that's huge and significant. The second thing is Medicare is, as we talked earlier, much more lenient with the telehealth, that they accept that as a face-to-face encounter, and they strongly encourage that. So really, in essence of the changes since the pandemic, those are the two vital ones.
Excellent.
Yeah.
Good. Those are good changes. Have you seen a decline in volume, or, with COVID-19, obviously every industry has been impacted.
Yeah.
I'm curious for home health specifically. Yeah. Have you seen a decline in referrals for home health?
Well, uniquely, basically in the hospitals, we've seen an increase in our referral volume, because basically patients are choosing to go home rather than rehab in a skilled nursing facility. Only reason being is because the visit restrictions. And that can be huge for the elderly going in. It can be very stressful. So from the hospital standpoint, an increase. And so the trickling effect is, from a skilled nursing perspective, the home health referrals are down because a lot of the skilled nursing facilities, they're census challenged right now.
Yes.
That patients are choosing to go home. In our assisted living communities, initially there was a decline. They would allow nursing in for essential services, but now they're letting therapies in because they've noticed that over time, some of the residents in the facilities have declined physically because of not having their therapy, and that their fall risk has increased. So they're slowly adapting and bringing in and integrating the therapist back in. In the physician's offices, there's been a decrease because of the fact that families and patients are very in tune to who they're allowing in and out of their home for safety precautions. So it's kind of a variance. You know, in some areas it's stronger, and in other areas it's weaker as far as the referral base.
Okay, that makes perfect sense. Yeah, so glad to see that you've been able to, in home health as a whole, been able to still execute and really benefit the patient regardless of the setting. But it does make sense. Obviously, with everything going on, people may want to skip a specific level of care to go home, right? With everything going on. So what would you say the future holds in healthcare, man? With everything going on, what's your projection?
Oh, it's just the fact that I don't know if we'll ever return to what we consider normal. I know as an individual that I think from the positive perspective, we're in tune to hand washing and proper hygiene. I think we're aware of social distancing. I am now aware, which I never was previously, about people in my immediate space. You know, I was always that hugger, that person who was just like right there. So I think that certain things will be forever changed, but I think that we're going to return to a new norm, if you will.
I agree. I agree. I know for us in our space and placement and everything else, the new normal, as a matter of fact, for those that are watching, so as of right now today, folks still can't go in and visit their loved ones in the communities. Unfortunately, that's going to get revisited next month by the governor. So we're looking forward to hopefully that getting revamped. But again, to your point, even when it does, it will be that new normal guideline. And I think within our industry, that new normal is going to be in effect for quite a while. Yeah. And it's going to dictate a lot. Yeah.
And I think since our seniors are so much at risk, I think that we'll be the last ones to kind of open that up. However, it's just heartbreaking to see when you visit skilled nursing facilities, as I wait outside for the referral to be brought to me, family members on the other side of the window, trying to engage and spend time with their loved one. And, with our seniors and, especially in healthcare settings, you worry about them. You worry about their well-being. They look forward to your visit, and from a spiritual kind of thing, it gives them the strength and the momentum to kind of like get stronger. So it's just interesting to see how unique families are in seeking out and making sure that they're visiting and supporting their loved ones.
Yeah, agreed. Good. So folks, thanks for watching.
Thank you.
I'll have Alan's information up here, Towers Home Health. We do these pretty frequently to inform the community of services such as Towers Home Health. So Alan, thank you so much for taking the time.
And I have to say, not only do I find the videos, because I've watched each and every one of them, I find them not only entertaining, but very informative. So thank you, Veronica, North Star, for doing them.
Thank you,
All
Alan.
right. Thank you for having me.
All right, folks. Take care. Thank you for your time.
Bye-bye.
Bye.